Hi, I'm Dr. Edna Reyes-Guerrero, and I am a podiatrist. I am board certified, and I work at the Wound Care Center at CHI St. Luke's Patients Medical Center. At the Wound Care Center, what gets referred there is patients who have diabetes, who have wounds, who have a history of complications and difficulty healing those wounds. By difficulty healing, I mean in a diabetic, in about a week and a half, if the wound is not healed, usually you need a multi-team approach. A multidisciplinary approach is when there's a bunch of physicians who work together to treat the patient. The problem with diabetes is that diabetes affects a lot of systems in the body. So in order to heal a wound, you need 4 things. You need to not have pressure to the area. You need to have adequate circulation. So for that, usually you need to see a vascular intervention. Number 3, you need to not have an infection. And if you do have an infection, it has to be treated by infectious disease most of the time because it tends to be a complex diabetic infection. And the last thing, you have to have good blood sugar control, adequate nutrition, and for that requires somebody helping you through your choices of food every day, because really, even though it's a daily task that we do every day that we don't seem to put a lot of attention into, it makes a big difference in diabetics. We usually send them for evaluation for hyperbarics because hyperbarics does oxygenate the tissue. And vascular is able to come in and usually do a procedure so you have optimal circulation, but some of those small vessels and some of that skin needs a little more. So that's where hyperbarics comes in. The goal of the Wound Care Center is limb salvage because losing a limb, there is a psychological component to it. There's also a component where the patient, the way they work, what they were doing, changes over time. So if we could keep as much as that lower extremity as possible, that is our goal. Diabetes is close to my heart. I'm Hispanic. Hispanic people have high prevalence of diabetes. I mean, it's in a lot of other communities, but it's in my family. What excites me is bringing somebody who kind of has been told bad news, and once we start working together, we see the progress, and the patient, once they're healed, they're able to move on with their regular life.